Evening, good afternoon, and good morning. This is the 1502nd day of the continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. MANISHA Vivek Solanki. Let us begin the session with 1 minute silent prayer. Thank you all. As you know, the International Forum for Promoting Homeopathy just celebrated our 1500 day last day. And we have a wonderful evening with the international faculties here. And almost all of them were delighted to hear that we are celebrating our day in such a beautiful night in that day. Anyway, let us begin the session. Today, let me introduce the guest of the day, Dr. MANISHA Vivek Solanki. Doctor has completed her MD and is the principal of DS Homeopathic Medical College, Pune, and the superintendent of NM Ranade Homeopathic Medical Hospital. And the most important point is that she studied in the same college and become the principal of the college. And that's one of the most important thing as far as Dr. Manisha Solanki is concerned. And she is the PG director, professor, and head of the Department of Practice of Medicine. And she has done a lot of charitable work along with the Ramakrishna Murthy, and she has her own private practice also. She has won several awards, Best Teacher Award from DS Homeopathic Medical College consecutively for 2 years from 2006 and 2007. She was awarded as one of the Best Teacher Awardees of the Maharashtra University of Health Sciences, Nasik, in 2010. And she was nominated to the Senate member of MUHS by Honorable Government of Maharashtra, and she was a member of the Board of Studies of Clinical Subject of the PG Board, member of Faculty of Homeopathic Medical Accreditation Committee also. She is the member of Ethics Committee of Maharashtra University of Health and Science, and she is recognized as the PG guide and examiner of both PG and UG degree. And she is a resource person nationally as well as internationally, and she has worked with the CCH as a resource person.
Madam, can you speak so that we can recognize you, madam? We are not getting your name.
It's a big.
What's
it's
the
a
name?
big one.
Madam?
She writes a regular article on health issues and homeopathy and homeopathy and public law. This is a very important subject also, public law. Writing something in that thing is a very, very good thing. And as you all know, we are about to discuss holistic care for mothers and children through homeopathy. That's a big subject. So we are very happy to welcome Dr. MANISHA VIVEK Solanki. Solanki, doctor. Please on phone. Yes, doctor, you can unmute. Is there any problem? Yes, yes, we proudly welcome, madam. You can begin the session.
Good evening, good morning, sir. Am I audible?
Yeah, you are not audible.
So I wanted to have a slide share, please.
Yes, yes.
Now you are the co-host now. Dr. Dhanesh, I am making you the host now.
Okay, sir.
Can you see my slides?
Yes, yes, we can see your side.
Yes.
Yes, madam, You can go ahead. Yes, we can. Everything is
Okay.
fine for you.
So, at the outset, I would like to thank the organizing committee of International Forum, and with the blessings from Dr. Sahani sir, I am again here on this forum to share on the topic of holistic care for mother and children through homeopathy. So once again, I thank everyone. Thank you, Dhanesh sir, for introducing me. And without taking much time, I shall start with my presentation. So the topic of today's presentation, which I have selected, has a reason that this is one of the very important topic, that the health status of women and children in our country remains extremely unsatisfactory even after more than 75 years of independence. So in spite of so many years in the health services and the introduction of Ayush Ministry with number of programs which the government has advocated, still we find that the health status of mothers and children is still at stake. So the public health issue confronting our country's main concern is that the women and children, they constitute 67.7% of population. Morbidity and mortality is associated with childbirth in women. There is high morbidity, mortality, which is associated with infants and young children. And this is why this becomes a very important public health issue. So we just want to know that so many initiatives have been taken by our government right from 1997, where they have launched the reproductive and child health program. After that, they had launched the National Health Policy of India, where the use of Ayush system of medicine in the provision of adequate health care under the overarching umbrella of National Health Framework. In 2005, it was reproductive and child health phase 2, which was focused on maternal and child morbidity, mortality, with the emphasis on rural health care. And in 2007, it was the national campaign for of homeopathy for mother and child care, which was extensively used in state and at national level with the coordination of Central Council for Research in Homeopathy. So the objective of this campaign, national campaign of mother and child, was to sensitize all the stakeholders regarding the strengths of homeopathy in mother and child care, to provide the platform for exchange of information about scope of homeopathy, to create avenues for coordination among the medical practitioners to promote integrated health, and to determine the applicability of community-based participatory approaches for future development and implementation of a comprehensive mother and child care program using homeopathy. So the objective of a national campaign, which if we understand, I think we all understand how important this topic is and how important it is that among the Ayush systems of medicine, homeopathy can be one of the most beneficial and mother and child friendly medicine, which can help the improving health of mother and child. See, the status is that the leading causes of maternal mortality, if you see that the main causes are hemorrhage, which can be hemorrhage either during pregnancy, postpartum, or in menstruation, which ultimately can result into profound anemia. The another cause is sepsis, and another cause is abortion. So these are the maternal morbidity causes, and you can see the percentage how high it is. The maternal mortality in India is also quite high because of various causes like, as I said, like hemorrhage, obstructed labor, hypertension, abortion, sepsis. The causes of under 5 children deaths in India, neonate, the death percentage is almost 50%, and in infancy you can find it 48%. The major causes of child mortality in India, they are prematurity, pneumonia or respiratory causes, birth asphyxia, diarrheal diseases, then injuries and acute bacterial sepsis. The major causes for infants mortality in India, as per the SRS report 2010 and 13, they are again prematurity, pneumonia, birth asphyxia, non-communicable diseases, other non-communicable diseases, diarrheal diseases, then congenital disorders and injuries. So, neonatal deaths, as per the sample of registration system, are same like prematurity, birth asphyxia, neonatal pneumonia, sepsis, congenital abnormalities, diarrheal diseases, and injuries. Knowing so many causes which are important as far as the mortality and morbidity for mother and child are concerned, there are some interventions for improving the health by government. They have advocated. So to reduce the mortality and the morbidity in mother and child, early or priority interventions with nutritional supplement in adolescent and pre-pregnancy females is very, very important. Also, the health education becomes very important. Education and counseling as far as sexual reproductive health becomes very important. Health education regarding menstrual hygiene and preventive health checkups are the priority interventions which have been helping in improving the mother and child care. Regarding pregnancy and childbirth, the priority interventions mentioned are antenatal checkups of especially of an high-risk pregnancy, then skilled obstetric care, immediate essential newborn care, postpartum care of mother and newborn, and utilization of intrauterine contraceptive devices for the safety of the mother for the previous pregnancies. The newborn and child care priority interventions are again home-based newborn care, facility-based care of the sick newborn, integrated management for common illnesses like diarrhea, pneumonia, nutritional requirement of a child, supplementary diet, immunization, and early detection and management of the congenital defects or the deficiencies and the other diseases. So these are the interventions which have been mentioned by the government so that improving the mother and child health, which is a main concern as far as the national campaign which was there, it has been mentioned. Now, knowing this background, knowing the prevalence of the health related problems of mother and child, when we place ourselves as a homeopath, we know that what are the strengths of homeopathy in mother and child care. So we all know that homeopathy is highly beneficial for various diseases which are related to mother and child. Since our strengths are the medicines are very safe to administer even during pregnancy and they do not have any adverse effects. It can be used during childbirth, also to control the problems which are associated with labor. It is effective for post-delivery and the lactational complaints. These sweet pills are very palatable and they are children friendly. They can take it very easily. Method of administration is very simple. So the whole focus that why homeopathy should be used for the mother and child care, I think these are the very important points as far as the common man are concerned, and therefore the more and more utilization of homeopathy can be done for the care of mother and child. So what are the important areas where homeopathy can be used for a healthy motherhood? We cannot cover all the points in the complaints or the disorders related to motherhood, but I have taken care of few important clinical entities where we know that homeopathy can be absolutely of a great help for a healthy motherhood. So we know that healthy motherhood is not only a magic word, motherhood that lights up the faces of all women. More than that, it is some eternal feeling, some exceptional bond that the mother or the women feel for this very special phenomena of life. The important problems, antenatal complaints where homeopathy can be of a great use, like anemia, nausea, vomiting, acidity, then heartburn, constipation, with or without piles or hemorrhoids of pregnancy. So let's see some of the important homeopathic medicines which are used for these common ailments. In case of morning sickness, now this is a very common presentation in a female in an early pregnancy. Once she misses her period and she starts complaining of persistent nausea or nausea and vomiting, few important remedies. If you open the repertory, you have number of remedies which you can see under nausea, vomiting during pregnancy. But clinically, I have seen that medicine like Ipecac, Symphoricarpus racemosa are of a great help, wherein we all know that in Ipecac there is persistent nausea and vomiting. And one of the indications where you can immediately differentiate Ipecac from the other remedies would be that tongue is very clean, moist, and there is lot of salivation which occurs. In case of Symphoricarpus racemosa, there is persistent vomiting of pregnancy, and the vomiting is aggravated even with slightest movement. Patient is always better by lying on her back, and patient has got gastric disturbances, water brash, bitter taste, and they have mentioned that no type of food patient can tolerate. So Ipecac, Symphoricarpus are very important remedies in case of morning sickness of pregnant women, that is nausea, vomiting. There are many other remedies like even Nux vomica, Arsenicum album, which can be of a great use for morning sickness depending on the totality of the symptoms. But I have used Ipecac and Symphoricarpus in number of patients with great results. Now, in case of the indigestion and acidity, which is also one of the very common complaints in patients in females who are pregnant, and the medicines like Arsenicum album, Nux vomica, Pulsatilla, and Carbovage. These are very important remedies which have helped females with complaints of indigestion and hyperacidity. In arsenic, we know that patients cannot bear the sight and smell of food. Even a thought of food can cause nausea, retching. Eating or drinking is not possible. Though patient is thirsty, patient is very weak, and the thirst is for small quantities of water, lot of heartburn, burning sensation, retrosternal, and the very important thing that you look at a female who's got acidity or hyperacidity, the face is showing great anxiety about the complaints, and there is anxiety felt in the pit of the stomach. In case of Nux vomica, the key indication, even if patient complains of hyperacidity, is always associated with an concomitant of unsatisfactory or not done sensation as far as the bowel movements are concerned. Patient also has got nausea in the morning. There is a weight and pain in stomach, and digestive disturbances are very much marked. Patient is very irritable also. Now, in case of Pulsatilla, you find that patient has got aversion to food, and there is bitter taste in mouth, diminished taste is there, bitter taste along with diminished taste sensation is there, and lot of water brash, and patient has got fullness of abdomen with gaseous distension, and craving for ice creams, or craving for fatty food which is there, but patient is not able to tolerate that. In case of Carbovage, there is rancid, sour eruptions and lot of gaseous distension, water brash, and the distension of abdomen is so much that the female complains of difficulty in breathing, or breathing has become a labored breathing. So these are few medicines in case of indigestion and acidity. Constipation is another important complaint in females who are pregnant, and there are no great remedies as far as the conventional medicine is concerned, like giving purgatives is not an help to a patient, but we have medicines like alumina, where the hard, dry, knotty stools patient doesn't have desire for fasting, and the stools are soft in consistency, but there is difficulty in fasting. And another remedy which I have already mentioned about nux vomica, where ineffectual desire for fasting, unsatisfactory stools are there, feeling as if the part is partly retained in the bowel, alternate constipation after, and diarrhea which is there, and patient has giving you history of abuse of purgatives. In case of obstinate constipation, patient does not have a desire to pass stools, round, hard, ball-like stools, we can think of opium, which is also one of the very important remedies. So these are few of the gastric complaints with which a female would come who's pregnant, and you can really help her with our homeopathic armamentum, which is with us. Now, anemia of pregnancy is also very common. We know it's a physiological cause in females, but because of the increase in the volume, and few remedies which are of a great help in a patient where anemia is marked during pregnancy is ferrum phos, calcarea phos, and China officinalis. These are the remedies which are like of a great help. Especially in ferrum phos, we know that the patient has got a pseudo plethora. They, whenever they get up from a lying down position, the face will become flushed, and violent local congestion is there. In case of calcarea phos, if you look at the face of a lady, then you will find that it is less chalky white, but it is more of a dirty white in color. And now the other features of calcarea phos I need not tell you, but this is an indication on which you can pinpoint that whether you want to give calcarea phos in females with pregnant women with anemia. China officinalis is another important remedy where there is either history of loss of fluid. Special symptoms are heaviness of head, loss of sight, fainting and ringing in ears, pale sallow complexion, sour belching, and poor digestion and bloated abdomen. So bloating is very marked of China. Syncopal feeling or an fainting attacks is another important indication of China. Anxiety and fears are also very common in pregnant females, and one of the very important remedy which can really help them is aconite, where there is a state of fear, anxiety, anguish of mind and body, great fear, anxiety, worry which accompanies every ailment, however trivial the ailments are. Patient has got fear of future, so patient will always keep on saying that, doctor, whether I will be able to complete my 9 months, anything will happen to me. Lot of restlessness is there. They are afraid of going in the crowd or crossing streets. So the fear symptoms of aconite, when you find they are very intense, associated with restlessness, I think it is one of the very important remedies for anxiety and fear in females. So these are the few important complaints which I have mentioned in a pregnant lady. During labor, you can also see that homeopathy can be of a great boon in patients who go in labor. And the important remedies which we can think of for a delayed labor or a prolonged labor is polyphyllum and gelsemium. Now we know that in polyphyllum, the pains are very deficient, and the progress of labor is delayed. Whereas in case of gelsemium, the false pains are there, the pains they pass up and down the back, and the spasmodic labor pains sometimes can result into premature labor. And gelsemium is very exhausted, dull, dizzy, drowsy, as we know during the labor. So these are two important remedies. When you find that the labor is delayed, you can give in 30 or 200 potency repeatedly, and that can help you, that can help a lady for an progress of labor. Now, in case of postnatal complaints, also homeopathy can be a boon. The first few days after the delivery can be very tiring and difficult for a mother. Everybody knows that. And immediately after labor, when the lady is exhausted, she's not able to take her baby because of either a prolonged labor or maybe the first time the lady's gone into a labor. And the remedy which can really help to energize a female could be an arnica, where complaints are sore, bruise type of feeling, soreness of the parts after severe labor, and violent pains, after pains which are there. So post-labor pains which a lady cannot tolerate, I think arnica is one of the very important remedies. The another remedy which can also be of a great help for the after pains of labor is gelsemium, and indicated symptom would be again the lady is very dull, dizzy, drowsy, lot of trembling, and a tired feeling with a slow pulse and muscular weakness. These are few indications where gelsemium can be of a great help. Another complaint of a female after labor would be suppression of secretion of milk. We have remedies like pulsatilla, ricinus communis, and lactula virosa. They can be of a great help in a female where the breast milk is suppressed or it's not sufficient, flow of milk is scanty, and if the mammy are swollen and painful and the lady is tearful all the time, we can think of pulsatilla. Whereas in case of ricinus communis, you will find that the breast is thick, swollen with the axillary glands, which are also swollen and painful, and there is a thin discharge which is coming from the breast. Lactula virosa is also a true galactagogue, which increases the milk secretion. We can say that this is an organopathic remedy which is useful in females where the milk is suppressed. Another problem where females would come to you in your clinic, or they are really suffering because of pain, that is cracked nipples. So even if they want to breastfeed their babies, because of the cracked nipples, they can't do that, or it is very, very painful. Two important remedies which I have used in my practice and I feel like mentioning over here. One is phytolacca, another is graphite. There are a number of remedies which are there we can use, but I'm just giving you few remedies which in our clinical practice we have used more commonly. So phytolacca is one with ulcerations which are there, whereas graphite says the nipples, they are cracked and they can bleed easily, and the breast is hard and swollen. Another complaint, post-pregnancy or immediately after labor, the lady can present to you with retention of urine, and we have good remedies like cantharis, arnica, and opium. In case of opium, we can find that the retention of urine is associated also with like an absolute constipation. The patient can't even pass feces, and there is no desire to pass urine or even feces. In case of arnica, we know that this happens especially that if we consider labor as one of the physical activity or injury, then in that case, if a lady is complaining of unable to pass urine with sore, bruised feeling and constant dribbling, we can think of arnica and it can give a great result. Whenever you find that there is burning, urination, strangulation, and retention of urine with cutting type of pain, cantharis can be of a great help for a lady. So during labor, when they take either an episiotomy or in a prolonged labor with some vaginal tears, they can occur. The only remedy which can give an 100% result in a female, which can lessen the effects of trauma, traumatization and shock postpartum is arnica. And for early healing of lacerations, arnica can be of a great help for healing of stitches and vaginal tears. So after sharing these common conditions during pregnancy, right from morning sickness, dyspepsia, constipation, to delayed labor or prolonged labor and the lactational problems which I have mentioned, we can now think of some important clinical conditions where homeopathy can be a great boon for complaints of children. So teething problem, so dentitional trouble is one of the very important condition for which the mothers, they can get their children to your clinic. And during dentition, we know that the common symptoms with which the child can present to you would be fever, irritability, delayed dentition, vomiting, diarrhea, and milk indigestion, where we know some important remedies which can be of a great help. Say, for example, if a child has vomiting, curdled milk, ethusa can be one important remedy. Milk indigestion is there, carb can be an important remedy. Great irritability, chamomilla is an important remedy. So, the dentitional trouble, I think homeopathy, even the people who do not know homeopathy, there is a dent tonic which they are using nowadays as a commercial product, but we have an individualized homeopathic medicines which can be of more help to a child based on symptomatology. Now, constipation in children is a problem, and the mothers can come to you. And the cause for constipation in children could be bottle-fed infants. At the time of weaning, it can happen. Then lack of dietary fiber. Fiber diet is not there. Then inadequate fluid intake is there. Lack of physical activity in children, and children who ignore the call for stool. So these are the causes where child can come to you with constipation. We first have to find out because of what it is happening. And our important medicines which can be of a great help based on the totality could be alumina, bryonia, and paraffin. And we know that in alumina, even the soft stools, they are difficult to expel. There is an inactivity of the rectum. In case of bryonia, the constipation and stools are hard, dry, as if burnt. And in case of paraffin, you will find that there is an obstinate constipation. For 3 to 4 days, the child is not passing motion, and because of that, there is severe pain in anus. Now, remedies which can be commonly used for the respiratory complaints in children are Ipecac, Drosera, natural salt. Now, when I say respiratory complaints, they can start from simple cold, cough, coryza, to involvement of the lower respiratory tract like bronchitis, bronchopneumonias, and based on the totality, we can think of Ipecac, Drosera, natural salt. So in Ipecac, you find that there is a paroxysms of retching and incessant or suffocative cough with every breath, and associated with that, I think, nausea and vomiting, which is very important. Now, in case of Drosera, we know that the cough is again very irritative, dry, which is aggravated at midnight as soon as the patient touches his head on the child touches the head on the bed, and the cough which comes in paroxysm. In case of natrum sulph, which we say that it is one of the very important remedies for asthma, you will find that the asthmatic attacks or the difficulty in breathing, where the mother says that every time in early morning around 4 to 5 o'clock, I find my child is coughing, and he coughs so much that unable to expectorate because of the glary mucus which is there. So natrum sulph is one important remedy. Then antimony tart, we all know that the rattle of antimony tart, we know the cough which is rattling, as if there is lot of phlegm in the chest. The medicine which is useful in children with bronchitis, bronchopneumonia, and even in some children where there is a childhood asthma with lot of suffocative shortness of breath, I think we can think of antimony tar. Phosphorus, arsenicum, iodine. These are also two important remedies which can be of a great help in children with recurrent respiratory complaints like suffocative cough of phosphorus which is there, or arsenicum iodatum, especially with consumptive or a tubercular constitution of children with hacking type of cough, yellow-green foul expectoration, we can think of arsenicum iodatum. For common cold also, they would like to take homeopathic medicines for their children nowadays rather than visiting a pediatrician, where you find that important remedies in the first stage, where you can think of aconite, belladonna, and arsenicum album. The coryza, which is watery, which arises from sudden exposure to the cold and of a sudden onset, is aconite. For belladonna, we know that associated with there is flushed face, headache is also very common, and in case of an arsenicum album, the thin watery discharge from the nose with lot of sneezing, and the child is exhausted. When the child is brought to the clinic, you can find that the child is exhausted. In case of bronchial asthma, also the homeopathy can be of a great boon, especially for pediatric asthma, and the medicines like, again, I'm not repeating the indications, but we all know in case of an ipecac, where the child suffocates and gags with the cough and spits up a very slight hemorrhage. That means what you say is little blood which can be spit out, and ipecac is one important remedy in childhood bronchial asthma. Then arsenicum album also is another important remedy with what you say, with very pointing indications of arsenicum album with night aggravation, thirst for small quantities, lot of exhaustion and anxiety, which is very much marked. Natrum sulph, the time modality, and the rattling mucus, which is difficult to expectorate, is an indication in case of bronchial asthma. And nux vomica is also an important remedy which we have found with suffocating paroxysms which are aggravated after midnight. In case of acute bronchitis, where you find that there is an inflammation of the bronchial tree, and this leads to swelling and mucus formation, difficult expectoration, and patient has got breathlessness. In initial stages, we can think of aconite, and little later as the stage proceeds further, that at the onset we can think of aconite, and maybe after a day or two, often we think that aconite is not going to be indicated. Then Bryonia alba is one of the important remedies where the child will have short, rapid breathing, deep breathing with great pain. Child wants to lie down still. In case of sinusitis of children, the remedies like hiparsal, calibichromicum, nux vomica, and sanguinaria, they are we use them very often in our OPDs, where in case of hipar, we know that child will have catarrh of nose, the ears, throat, larynx. They are also sometimes painful along with nasal discharge. In case of calibichrome, the discharge is very ropey, stringy. Then in case of nux vomica, you will find the nose is stuffed up with lot of sneezing, and fluent coryza, which where the child is in a room. In sanguinaria, spasmodic cough and whooping cough, the nasal membranes are very dry and congested. So after a few of these common symptoms in children, the parents would come to a homeopathic physician, especially for behavioral problems of children. Some children, they create a lot of problems for the parents and teachers due to their typical unacceptable behavior, like hostile, aggressive, or disruptive behavior. They're very mischievous and rebellious in their manner. Then there is great difficulty in following rules and behaving in socially unaccepted way. and the children, they have very offending acts and deeds. So the parents feel very embarrassed because of such behavior of a child, and they do take help of the homeopathic physicians. A few important remedies as a pointers in children. Say, for example, some children, the parents would come, or they get some complaints from their school that the child has a habit of stealing. You can think of absenteeism. The child has a habit of lying every time. Whenever you ask something, the child will always keep on lying. The medicine which we have found very useful is opium. Excessive anger and temper tantrum, all of us, I think we use day in and day out, that is chamomilla. The child is very cruel, revengeful. We can think of nitric acid. The child has a destroying nature. So think of staphysagria. The child is rebellious, does not obey orders of elders. And again, this is a very embarrassing situation for mother or especially for parents. We can think of tarantula. Then child can harm himself or herself. Aurum metallicum, and in some of the children you find early sexual activity. You can think of buforana. So these are few complaints where the parents can come and we can be of a great help to them. The habit disorders where the homeopathic medicines can be of a great help would be thumb sucking and nail biting. Very common presentation. Children, parents, they come and they tell that how much we are telling our child, or we are trying to do so many tricks so that the thumb sucking can stop. But I think the homeopathic intervention, along with counseling or along with making child understand their habits, can be of a great help. Otherwise, such habits, they do not go very easily. In thumb sucking, we have seen Calcaria phos, ipecac, natramur, and silica are important remedies. They can help. In case of nail biting, arum triphalum, arsenic, senna, and veratrum. Now, anxiety in children is also very, very common. So fear and anxiety, where you will find that because of fear and anxiety, either the child is sad, child would avoid meeting new people. There will be a lot of defiance or sleep issues or anger or irritability. So these are some of the, some of the symptoms with which you can understand the child has got anxiety or fear. Aconite, belladonna, borax, stramonium, with their characteristic indications like fear of downward motion. We can always think of medicine like borax or sanicula. If based on the totality, if we give, I think we can give lot of, we can be of a lot of help to the parents for such fear. Now, anger, irritability, very common phenomena which you will find nowadays with children. Maybe a lifestyle disorder, maybe a lot of environmental changes which are occurring, which are adding to anger and irritability at such a young age. And the medicines which, and the children, they have an violent bursts of anger, where aconite could be very important remedy. Belladonna can be very important remedy. And another important remedy, that is staphysagria. Where irritability, especially they cannot take any type of a criticism. If you get a history, and if the mother, and if you have an skills to find out why the child is getting angry, and criticism cannot be taken by staphysagria children. Chamomilla, Nux vomica, and tarantula. Other three important remedies for anger, irritability, or anger and rage. In case of chamomilla, great violence is there, oversensitiveness and irritability of chamomilla is marked. In case of Nux vomica, also you will find lot of irritability. They are ill-humored. With anger, they can be more violent also. And in case of tarantula, they also have a desire to strike others or strike oneself. Some children, parents can come to you saying that some children have a problem of runaway reaction. They want to run away from home, they want to run away from the school, and we can think of remedies like hyoscyamus, stramonium, and veratrum album. So, impulse, in case of veratrum album, you can find that they have an impulse to bite. And in case of hyoscyamus, they want to leave home and go out without telling their parents. So these are, again, as I said, that few reactions which you can see, and the other conventional medicine will not have any medicine to help such children, but homeopathy can definitely help them. Some children are very timid and bashful. Parents, they also have a great concern for children who are very bashful and timid. The medicine like pulsatilla and coca, we have found very useful in children who are bashful. We know pulsatilla is very lachrymose, timid, and mild and yielding disposition. And in case of coca, though the child is irritable, wants solitude, sense of right and wrong has gone in case of coca, but they are very bashful and melancholy. The another complaint is late learning to talk. Only if the child is unable to frame sentences even of 2 or 3 words till 3 years of the age, we say that the child has late learning to walk. Learning to talk. Baratacarb, syphilinum, and anacardium we have used in case of late learning to talk. In children who have stammering speech or interruption or not a fluent speech, then stramonium, bovista, calcarea carb, and causticum. These are the medicines which we have found of a great help in reducing the speech problem or the delayed speech or interrupted speech, that is stammering, which is there. Now, enuresis is another problem where the parents, they would like to take homeopathic medicines, and we know even after the age of 5, if the child keeps on wetting the bed, it is very tiresome, especially for a mother. The medicines like sepia, creosote, calcarea carb, and medorinum, they are of a great help. I remember a case where the parents, they had brought their child, and the enuresis, they had tried the allopathic medicines for that, but only one indication which we found, and we gave a single dose of medorinum in a higher potency. The child had a habit of sleeping on stomach, and of course the child was hot, and there were other symptoms which were also matching, but only on this symptom we gave medorinum, and I think it was very rewarding that not even within 2 follow-ups of a case, the parents were so happy that the child had become completely dry and there was no enuresis thereafter. So I think these were few complaints which I thought of sharing with you all when we talk about homeopathy, holistic care of mother and child with homeopathy. There are many other complaints with which they can come. Even the pregnant ladies, they can come, or the infants and children, they can come. Based on totality, we can definitely help them. Knowing the prevalence, knowing the health status of mother and child, I think what government and Ministry of Ayush, they have taken initiative, they are of a great help. If they can go to the primary healthcare centers where homeopathy can be used for these children, then I think it can be a great boon. So to conclude this session, I would like to just say that mother and child constitute the most important and a huge section of the society that can be best covered with homeopathic medicines. individualistic and holistic approach is effectively used for promotive, preventive, as well as curative for various complaints which we can manage for the mother and child. So with this, I conclude my presentation. If you have any questions, you can ask. I have not purposely taken the case presentations as such because it's a very vast topic. So I just wanted to share that these are the areas very easily we can make use of homeopathic medicine. Thank you, sir.
Thank you, Dr. MANISHA VIVEK Solanki, madam. It's really a very good as well as an impressive session because you covered almost every part of the problem that faced by the mother and how homeopathy can manage the same as well as the child when soon after birth also. What are the common diseases that can affect both in mother as well as in child and in the later part of the childhood also. Anyway, we're really happy to have such a session because you almost pointed out almost all the medicines that can work in different circumstances and different conditions of these cases. And congratulations to you for that such a session. That's why the students of your college will definitely very good have a principle in you because not only you are a principal, but you are a very good homeopathic lover too. That's why you can do all these things. And congratulations once again for the same. And the time for discussion and those who want to come up with your comments can, as well as you can, you want to have a question, then you can raise it after raising the hand here. I think Dr. Manager is always there to begin the session. Yes. Yes.
Thank you, Dr. Thanesh, and the nice presentation. As we all know that Hanuman described homeopathy as the greatest gift of God. This is a living example. Very, very practical and very, very simple on the mother and child. And I think it is up to the government of India and other national governments to implement this as a nationwide program so that crores and crores of people will be benefited. Moreover, the antibiotic, the drug resistant problems, the underworld reactions problems, all these things can be reduced, and I think India can take a lead role there. And it can be presented as mother and child program. Nice presentation. Moreover, it's a totally practical system. The bedwetting, the irritability. Moreover, the another one is important you mentioned is the morning sickness. I think the Sorayanam is the leading remedy, leading medicine, not rather remedy, but medicine. Because Hanuman indicates that this is the reason of the latent sora. Because of the presence of latent sora, the morning sickness occurs and in the violent form. So by giving the antisoric medicine, this can be controlled. So what happened is that we'll get two benefits. The health that the child delivered will be healthy one, and the mother, the postpartum complications, all these things can be avoided. Anyway, nice presentation, and you continue to attend the program. Moreover, the beloved students from your institution should be forced to attend this program. They will benefit in the future. Thank you.
Thank you.
That's what I would like to add also, because our students are not following all those things, because it is a high time to bring notice of the students about this kind of webinars, which will really enrich them to become very good homeopathic doctors in the future. Because we want such good doctors or very highly molded doctors to in the future, since we have to become, we are fighting with the other systems to become the number one. We are, as you all know, that we are the number two at now, but we want to go up and reach the dream position of number one. So in order to become that level, our students need to come back to all these things. Nowadays, what happens is the most of the students are looking for their Instagrams and other things, but they are not concentrating on homeopathy. This is a bad thing. Okay, Dr. Manoj.
Yes, Dr. Dhanesh, there's an important juncture because the India government has decided to include in all Indian Institute of Medical Science homeopathy as well. So we should provide quality physicians there. How it can be achieved? Not an effort from a single person. It should have combined effect, combined effort. This IFPH provides without any expense. They can attend this program free, no cost. Nobody is charging, no membership is there. That's the most interesting thing. Moreover, this already surpassed the 1500 days, come continuous. That too now in 3 sessions in Hindi, English, and Malayalam. For the last, Dr. Tanesh is the backbone, and as well as our Sahani sir also. These two fellows are really doing great job, and we must give a big salute to them. Thank you.
Yes, Dr. Manoj, we need this kind of things to reach the students, and it is, madam, you can advise your students to visit our YouTube channel, IFPH Homeopathy, so that they can study what are the some of our earlier presentations also. Please try to share the, once I get your number, I shall share the link of every day so that you can share it with your students, particularly the senior students at least, so that not only even for the junior students also, that will bring confidence among them to practice homeopathy in the future. And it's up to Dr. Ramparesh sir to say a lot of thanks also to this session. You can make your statement here.
Thank you, Dr. Dhaneji, and congratulations, Dr. Manisha Madam. Very nice presentation, excellent session. Mother and children, homeopathic, very good practical use of medicine, homeopathic, very many kinds of pills, homeopathic medicine, pregnancy to child, and after child dentition period, fear, etc. Very, very important medicine. Knowledgeable medicine deals the presentation and benefit of all person. So very, very thanks, madam. Again, presentation, behalf of IFPH, whole team. Very, very thanks, madam. Thank you.
Madam, what is the present situation in your college? All the seats are filled, or whether still seats are vacant?
So now the admission process is going on. This year we are still not sure, but till last year we had our admissions full, sir. So we expect that this year also it should be full, but because new colleges have come up, 10 new medical colleges have come up. So we don't know this time what is going to happen.
Okay. What kind of support you get from the government there?
Sir, in Maharashtra, for the first, only one homeopathic medical college, which is a government college. All colleges are private colleges. So you can understand, but still there is one more college which is going to come up, which is a recent news they are saying. So if more government colleges would come, I think we will have a better patronage for homeopathy.
What about the government dispensaries and government hospitals?
No, sir. Maharashtra, we have only one government hospital.
So it is a high time to bring all this the situation in Kerala, because we have more than 1,000 doctors in government sector working, and we have more than 36 government hospitals here with 5 homeopathic medical college. All are paying a UGC salary to our doctors, our teachers there. So it is high time to bring all these things to the notice of your students and let them make a movement towards until and unless they get the benefit out of this kind of thing in homeopathy too. Okay. Thank you once again, the participants as well as our guest, Dr. MANISHA Solanki, madam. And tomorrow we will have a session from Dr. Surjit Makkar, and he will be talking about the management of diseases of pets with homeopathy. He's an veterinarian and practicing homeopathy. Thank you all. Good night. Thank you, madam.
Thank you, sir.